Joins the rest of the world in the commemoration of the World Tuberculosis Day. This day is commemorated annually on March 24th to raise public awareness of tuberculosis and to reaffirm national and international commitment to the TB response. World TB Day is a day set aside to remind people of the global health threats presented by tuberculosis and to recognize the collective efforts of all countries and partners in the fight against tuberculosis. Ladies and gentlemen, TB remains a disease of great public health importance globally, and the Gambia is no exception. Worldwide, TB is the 13th leading cause of death and the second leading infectious killer after COVID-19. Annually, an estimated 10 million people fall ill with TB. A total of 1.5 million people died of tuberculosis in 2020, including 214,000 who also had HIV and AIDS. Globally, the TB incidence is falling at about 2% per year, and between 2015 and 2020, the cumulative reduction was 11%. This was just a little over halfway to the end TB strategy milestone of 20% reduction between 2015 and 2020. In October 2021, the World Health Organization estimated 66 million lives were saved through TB diagnosis and treatment between the year 2000 and 2020, which is a significant achievement. In 2021, a total of 2,279 all forms of TB cases were diagnosed in the Gambia. 88% of these TB patients were counseled and tested for HIV. Over 85% of the notified TB patients are successfully treated as of 2020. In the Gambia, diagnosis and treatment of TB is provided free of charge to all, irrespective of nationality, and there has never been stock out of anti-TB drugs in the country. In addition to TB treatment, the Ministry of Health is also providing nutritional support to all drug-resistant TB cases and transport refund to all bacteriologically positive pulmonary TB patients. Ladies and gentlemen, the theme for this year's World TB Day is Invest to End TB, Save Lives. This team demands for more investment in TB care and prevention. Global investment is currently less than 40% of the $15 billion per year that the global leaders committed to in 2018. Ladies and gentlemen, His Excellency, the President, Mr. Adama Barrow, recognizes health as a central long-term driver of economic growth, and as a result, the health sector is one of his topmost priorities. People have to be healthy to be able to participate effectively in the development process, particularly in the implementation of the National Development Plan. As a result of the strong political commitment, the Ministry of Health has over the years made progress in the fight against TB in the Gambia. The Ministry has expanded diagnostic and treatment facilities countrywide, which resulted in improved access to TB services. However, based on TB surveillance data, the number of all forms of TB cases increased from 1,812 in 2006 to 2,635 in 2019. However, comparative percentage analysis would have meant a reduction. There has been a decline in TB case notification for 2020 and 2021 due to the COVID-19 pandemic. This calls for increased vigilance and stepping up of TB prevention strategies. In 2019, the Ministry of Health inaugurated a biological safety level 3 modular laboratory to get our laboratory operations faster, and this was done to the tune of $1 million US. Recently, line probe assay, that is LPA, a molecular technique for DST, has also been introduced at the National Public Health Laboratory. Ladies and gentlemen, as part of the events marking this year's World TB Day, the Ministry of Health and partners will conduct a series of activities intended to raise public awareness of TB and HIV and AIDS. On behalf of the government of the Gambia and on my own behalf, I wish to thank all healthcare workers, Global Fund, WHO, MRC, civil society and the private sector for their consistent support in the fight against tuberculosis in the Gambia. I'm confident that with this robust partnership, we will continue to make significant progress in TB care and prevention in the Gambia. Thank you all for your kind attention. Yes.
Amen. May Allah accept our prayers. Today we are witnessing a very important day again in the calendar of the Minister of Health and the Governor of the Gambia, where we are witnessing the arrival of 25 remaining ambulances out of the 80. You remember when we did the formal, the first handing over by His Excellency the President, somewhere in Banjul, and then the Minister, Honorable Minister of Health also mention that there are 25 more ambulances that are coming, and today this is what we are seeing here today. These are the ambulances that the Minister promised to deliver to the communities of the Gambia to ease the burden of transportation, especially those who are supposed to be referred from one level to the other. So this is a very important day for us, and we are happy to be here. And then I now invite the Permanent Secretary P.S. Damfa to give a welcome statement on this. Is that all right? No, please, just one word, please. Please, go ahead.
Good afternoon, ladies and gentlemen. I want to take this opportunity to welcome all of you to this handing over of the 25 ambulances. As Ms. Njai has rightly said, we purchased 80 ambulances. We've received 55 ambulances so far, and the remaining 25 ambulances, those are the ones that have just arrived, and the Minister is here to receive them from UNOPS. The procurement process was done by UNOPS, but was 100% financed by government of the Gambia. It's not financed by any donor, but the government of the Gambia process, that was what was used to finance the 80 ambulances for the various communities of the Gambia. These ambulances are procured mainly to ease the burden of referral, especially communities that are far from the facilities, and they are also hard to reach communities. We want to take the opportunity to thank UNOPS for the support that they have provided to the ministry in terms of the procurement process. That's the UN agency that has provided the procurement services, and they got us all these ambulances. And we want to thank them once again for the services that they provided. And now we want to invite the minister just to make a short statement before we do the handing over. You can.
Cfao can want to say something. Okay. And Abdullah is here to give a statement on behalf of UNOPS, and then from there he will hand over the keys to the Honorable Minister, who will receive the keys and now also make a statement. Abdullah, welcome.
Thank you very much. Good afternoon, the Honorable Minister of Health, the Permanent Secretary and the officials from the Ministry of Health, the staff of Cfao who have been very supportive of this initiative since we began, and members of the press, good afternoon. On behalf of the United Nations Office for Project Services, we're very delighted to enter into partnership with the Ministry of Health to support the procurement of these ambulances, which we believe would immensely help to bridge that gap between local communities and access to health services in local communities that are hard to reach. This is the final phase of 4 handovers that we've done in the past. We've already handed over 55 ambulances in the past from late last year. And today we're here to witness the handover of the final batch of ambulances to the Ministry of Health. We as a UN agency, we're very delighted to support the government of the Gambia. And to clarify, the government of the Gambia provided financing for this procurement. We, as a United Nations procurement agency, facilitated the procurement through our systems and our networks around the world. I want to thank the Ministry, through the government of the Gambia, for trusting us with this project, and also to thank Cfao for always being available to process these ambulances when they arrive in the country, and to everyone involved in this project since the beginning. We are immensely delighted to be part of this great initiative for the government of the Gambia. And on that note, we want to thank everybody for their presence here and wish you a good rest of the day. Thank you very much.
First of all, we are really happy to receive all of you guys today in our premises on the final phase of the delivery of 80 ambulances. The collaboration started months ago between the Ministry, UNOPS and Cfao. Here we are today delivering the final 25 units. On behalf of the management and staff of Cfao, we wish to thank UNOPS, Ministry of Health and the government of the Gambia. Thank you very much.
That's a different one.
Yeah.
At the back. I see your point.
Yeah.
Good. Thank you. Yeah. Thank you. Thank you very much. Yeah. Thank you very much. Thank you. Yeah. Thank you. Thank you. Yeah. Pierce. Yeah. Pierce. Yeah.
So the keys have been handed over to the Honorable Minister of Health, Honorable Lamin Samate, who will now come to give a statement after receiving the keys, and now will tell you what the ambulance where they'll be going, the purposes, and we all know the purpose, very important purpose they're going to serve in the communities. So he's going to elaborate on that. Honorable Minister, you are most welcome to the podium to give a statement.
Thank you. Thank you very much, Ms. Sanjay. Distinguished ladies and gentlemen, we are delighted once again to stand in front of you here to receive these ambulances that were procured for the government of the Gambia, by the government of the Gambia, but the procurement process was carried out by UNOPS, which is a United Nations agency. And as we said earlier, it's an agency that facilitates quite a lot of activities for governments and other entities. But the procurement, the funding was 100% Gambia government funded. We keep on emphasizing that. I think this is a culmination of the efforts that have been put in place by numerous team players. But I think we start by giving you the vision of the government of His Excellency President Adama Barrow. Since coming into office, he has put healthcare delivery, quality healthcare delivery to the people of this country, in fact, his topmost priority. The President and government recognizes the importance of having a healthy population for national development. Without a healthy population, we cannot think of farming. We cannot think of any activity of development. So having a healthy population is critical. In fact, investing in health is actually investing in the development of a country. Recognizing these facts and putting into cognizance the challenging health sector we inherited, the challenges in the health sector with dilapidated infrastructure, obsolete equipment, unavailability of supplies. The government sat down and re-strategized. And the strategies are being implemented in 4 areas. One of the areas is to try to get health care to the doorsteps of the people. By so doing, the government has embarked upon construction of new health centers across the length and breadth of this country, construction of new health posts across the length and breadth of this country, construction of an emergency treatment center at Farato, which marks the beginning of the construction of the 1,500-bed teaching hospital, construction of 8 COVID-19 treatment centers across the length and breadth of this country, construction and renovation, upgrading of the Ndeban Health Facility in Bakau to serve as COVID treatment center, expansion, renovation, and upgrading of the polyclinic in Banjul, expansion, renovation, and upgrading of the Edward Francis Small Teaching Hospital, and series of other activities of expansion and renovation across the length and breadth of this country. This is to improve on the services that are being delivered to the people of this country. This is the first step. The second step is the procurement of equipment, because you can have the structures, but you need the equipment, you need the tools to make sure that the services that are needed are provided. The government of the Gambia and partners have already spent over $500 million on the procurement of life-saving equipment to the health facilities of this country. Never before in the history of this country has such a thing happened, and that has happened. The third step certainly is ensuring that there is consistent flow of drugs, medications, and consumables to the health facilities of this country. The government has increased the drug budget. When His Excellency came into office 5 years ago, what was being spent or what was being earmarked on the procurement of drugs was not more than $60 million, and unfortunately not all that was even spent. But currently the government is spending over $200 million on the procurement of drugs and consumables for the health sector of this country. That's a remarkable plus. But with all that, you need the people who are going to do the work. So we are training the workforce. We are training the public health officers, the nurses, the doctors. They are specializing. We are increasing the nursing schools. We are increasing the schools for pharmacy. A school of dentistry has started in this country now. We will soon start, inshallah, a school of pharmacy in this country. We are doing postgraduate training. Doctors are specializing now in obstetrics and gynecology, surgery, pediatrics, family medicine, and so on and so forth. So a lot is happening in the health sector. But when the president went round to talk to the people of this country to know their challenges, one issue that was topmost was access to the health facilities. You can build health facilities, but you need roads for people to get to the health facilities. You need vehicles for people to get to the health facilities. We were somewhere up country and we had horrific stories. A traditional birth companion was narrating a story when there was a pregnant woman who went into labor late at night, and the woman was placed on a donkey cart to get to the main road so she could get to the health facility to deliver. Now on the way to the main road, they were ambushed by wolves. They were ambushed by wolves, crisscrossing their path. Out of fear, justifiable fear, they had to go back home, and the woman delivered at home. In the same area, a similar thing, this time a horse cart, a pregnant woman. And they were again ambushed by wolves. And then the horse itself was so afraid that he started running at full speed with the pregnant woman on the horse cart until they reached the main road. Then the horse slowed down. These had been the realities. And the president said this is not acceptable. People living anywhere in this country are Gambians, and we as a government need to do something for them. And that is what made him think of bringing these community ambulances to the doorsteps of the people of this country. And I think it's a remarkable effort. He needs a big round of applause. These community ambulances, there are 80 of them, and the way they are supposed to function, they will stay in the communities, and there will be a unique number, 116, that people in the community and the community health officials, the village health workers will have those numbers, and people could call when they have an emergency, a toll-free number that they are going to use and no one is going to pay, even if they do not have any credit on their phones. And this ambulance will go all the way to their home to pick the pregnant woman in labor or the very sick person all the way to a health facility. I think it has never happened in the history of this country. So this is history in the making, and this has not happened in many countries that I know of in the whole of Africa. This is the first time in the history of many countries for such a thing to happen, and I think it's remarkable. The procurement process started sometime last year, and we had received a number of batches from UNOPS. Before today, we had received 55. The delivery had been delayed because of a number of factors, and one of which we were told was because of the global shipping challenges that was caused by the COVID-19 pandemic. So the people, the permanent secretary and UNOPS have been under a lot of pressure to make sure that these are delivered. I personally made sure that we followed up regularly, and we are happy. We thank the Almighty Allah for making this possible. Today we received the last 25, making the total number of community ambulances in this country to 80 ambulances. And this is remarkable because in the past 2 years, these 80 community ambulances and the state-of-the-art COVID-19 ambulances, which are 10, has made the total number of ambulances, new ambulances in this country to become 90. Before the arrival of these ambulances, the country did not have much more than 60 ambulances. And up to 45 of those ambulances do not belong to the government. They belong to Riders for Health. So the government itself didn't have up to 20 ambulances. But now we have brought in 90 ambulances, and I think the government of the day, the government of His Excellency, is putting the health of the people of this country first. At this point, as I wrap up, I thank His Excellency for the immense foresight, for the support, for the initiative, for the good leadership, for the exemplary leadership, for thinking of this and making sure that we are able to do so. We equally thank the National Assembly for their support, because when we went to the National Assembly for the supplementary appropriation for us to be able to procure this ambulance, there was overwhelming support, and we thank all the Assembly members. We thank UNOPS for all their efforts, paying attention to details, to to make sure that these ambulances get here, and for their patients, because we put a lot of pressure on them. We told them that the delivery time that you told us is due and you need to deliver. And they also were running around to ensure that this was done. And you can see the quality of ambulances we are receiving here today. These are not just ordinary ambulances. These are 4x4 desert type of ambulances that are robust and they are ready for the task. So we thank them. We sincerely thank the Permanent Secretary and his team as well for all the coordination, for all the hard work, for making sure that whoever needed to do whatever they did, they were able to do so. And the entire Ministry of Health team, Mr. Njai and his team, the logistic team, Mr. Sabali, the procurement team, Mr. Jawo, and the Directorate of Health Services, and all the people who contributed for this immense success. We thank the Cfao for their participation in this entire process, because we know getting vehicles is just one part of it, but maintaining those vehicles and making sure that they serve the people of this country for the duration that they are expected to serve plays a very important role in the overall process. And they have started already providing those kind of services. And we also urge them and encourage them to see this as a national responsibility, because what we say is this is nation building and they have a big role to contribute to the building of the Gambia we want. So we have started. The people of this country are aware that the government of His Excellency has started the march towards the Gambia we want. Inshallah, we will get to the Gambia we want very soon. To the people who have been promised these ambulances in the various communities, who have been waiting, we wish to inform them that the ambulances have arrived and distribution will start today, inshallah, and then they will be receiving their ambulances today. So we march towards the Gambia we want. At this juncture, I thank the ladies and gentlemen of the media who are always there, who have been there from the beginning. They are always there, come rain, come shine. They're always there together with us. It's a partnership for national development, and we wish to tell you that we appreciate your efforts, and your efforts are appreciated by the people of this country, and they are contributing a lot to the development of this country. So keep it up. Once again, I wish to thank you very much for your kind attention. Thank you. Good, thank you. Good. Yeah.
Honorable, for that excellent statement. I also want to say thank you to all of you for coming. The Director of National Midwifery Services, the procurement team, Deputy Director of Health Services, the Permanent Secretary, Honorable Minister, the entire team of Cfao. We want to thank all of you for coming, and also Cfao for giving us this very beautiful place to stand to give our statements. So we want to thank all of you. If you want to have the side interviews with the Honorable Minister in local languages, we'll also allow you just for 5 minutes, because it's also on his journey. I know, Binta, you are eager to have an interview with him. And likewise, N24, so you can have a joint interview with him in local language, Mandinka and Wolof, and then he can depart for his side. Thank you very much. Thank you. Now.
The sound of it.
pura jangeni sato kono so bo tiloto bi wala bendi jambi adum bi mun so bu nari mon mi ko ngi la hidla nu ka pour ga ambulance sodla ala alhamdulillah bebe ambulance sodla mi ko be la hit bawo nga to nga lal tombong na regional office nga ni ka sara la tombong dal mi ko yenta ambulance sodla be sa fetala be laring so kama mini ya sodno wolta sodla sa bar min ma sodno wala ba sodla adun listo be la dem bulle ada bi jangen na ana listo na nyami adun amaka commune nga sigala nga di sate kenna bare sato la sula ko wala na comme sato jam fara ñola don mi ko be da sato community clinical be jam ko leptan leptan be je bar am la so tebulu e français multa din sato nara ya blade moto ko ya sambale leptan mi ko fana tout mi ko jarolon so sona na woto
wolen toñade don ni nanda na jibe ñin temben na molbe bori ko le fana kumbo kan dina ambulance ol fana la ko mun alhamdulillah ka ambulance fo sam dina borol fana la fana
yalon commune syndrome fenkol le ka fuñu face islam ministre fala diamo kono ala hamo min de prokajo ko boro so lalbe do taring kajo ko mol fanan kana bata kata leftano ka bol leftano ka leftan dodo wala ambulance ni ajiba ko mada bakay pour ka makoro ke nim mo sasara tarba mo sasara kandi sasa kadiyama isa bonno ya sambu lado mi anko ase boro jarolo so naje o jarolo fanan ko ministre fa karando fanan be ke kanne na leftano bundal fanan be karando yeri wadi kanne pour mo jamale karang ya ma ciol soto londo soto adim fanan boro fanan star ñoo sa woni ambulance fanan be kafru ñoma comme système health mo système wolt e bele ka kafu ñoma ka clint so kamala ambulance dabe système ñu kono staff dabe système kono boro dabe système kono joron fanan dabe système ñu kono so kamala hamen ko lam pour ka be ala diamo kono foje ko wol bebe sodla ni ala sonda ada be fero comme be dakan step by step adu no ala sonda o frambe ko mi kala ko mi anko o fanan automol kumpala imba ko kanja
mol fanal be la fela kalom ba ke radio fanan na fanala ko la mele alan ko fa wala be dende mol ni la taka ambulance on fana comme ni la taka commande ni nata na jibe avec kala kuti me alan ko sate ko no dol asikeno e be la fela commande kala bare credit gol ni ko be kala kuti me alan ko asi dol torano sudo ale ambulance comme commande la fanala ali o la nyaade
ngala nyami wala mo be fero la kan pour ka joko number so number mi anko misal fe nin ko 1025 yalla mo ko fe njor ñim fana 116 o fana bu ko le number mi anko mol bo ko la nim parada bala dron minanga kankula ka mo la ko sai ni so ka bo leptan kare ka leptan kare wala so ambulance ka bo leptan ngi ka sa do ka mo kam je men ko sa mi anko sa ko le na la ta kan mbiram ko ayenda demaro sodla o number je bol ko man la dron ambulance na o mariska sama leptan ngi to nimpara do namba fana mbala fa wada wade bo fana fana mo ba kankula la mol sa kam da namba adibe kol kala nyamin adibe nibe daminto ebe kol kala nyadim fana kon la fala mo ko ni misal be siaral isod la sele be dan to kol ni kol ka don siaral be dawda wal beta kol ni gele ba je ko be ma ko kala nyama so mo kule men ko bo fana xami kan inshallah mol be contane wa karol
baraka
Allah baraka baka thank
better, but I thought you could take it together. For? Like a different.
After this, 1 minute.
Okay, fine.
Then allow us to do it, and then you can do yours.
We are doing both TV and radio. They are doing both. Okay, so go on.
It's fine. All right. So, Honorable Minister, ambulance will felenting for data, and when I'm in final phase, Ninti, many along Koma. Muna Munino. Moja mal bije se jakale ya fako fo political ya tinna nying ambulance wol nata katu namol dol moy la on social media fam nying ambulance wol la cool fo tay ba fo kanne ko nying keta kulti mi yalon ko anata time campaign wato le kono dol fana nata campaign wato le kono e be munesto no la pour ka fon na viwo so le min yalon ko be bitilo jibe kan
abaraka bake bitilo molo kontanta bake kallo jambi andum baltol fanan tentula mbal jayla bawo altol le ka kibarol futandi molla ko nga lo nyamin brim president baro sita kaka president nyum banko kan aku jamale tara kolearing jada kende ala karola ku silo la karola karambungol la karola anin ku jamal la karola bari president on nata foko e banko te yirwa no la nimmolu jatu man sahaya senote keno la nimmol jatu man sahaya doku kotangol de keno la nimmol jatu man sahaya wala na kase kolea nyawonya fujate kendia fanna yi bambang wokono bring president barobe sila ngatara loptani jama mantar betiaring komi ngali banjul loptano fon je nyami ngatara jorang jama man soto nyimbanko kan ngatara borol la manko sembo warata mansakunda ka kodo min dapansi borol to nunga mansia president o ko fonga ferolu ke nga jata kendia sabati ndi jang imbanko ka inshallah aman sonia ka dunniya ko ta kolearing janni be futala e lafta futala dami nga ka koleale wokono ikaje dolu kapasi dolu kala fila pisal bari mo kana pisali go inshallah imbanko do kule datita jang ko lafta Gambia ke nyami inshallah Gambia be kala wo nyamale kadum president Barrow ya hamo soto aya nganio soto aya fero soto andung alala de mari jamale bakang kadum naya ku abulo ma kokula ayen tol bulala nkanaji ala ka sone andinge ya lo wo mansa na harjelem mansa se soto nole mi alonga betiata anganio seniata bari kol se koleabul na abulo ma kolla abuga sone baning alay mansaharje ma dinna naya bulo ma ko lantol ka soni ajiji o mo kayra balet ndang la korosiro bodum ambulance la ko mansakunda nataje ko fo molu ye futano lo tanol to kadum fonga nyin senendi molla ngalong almanta mo soto baki barin ko jata kendi ala bunda president nataji na sita nga jibe ko mba ko to patola karanani la si fanna folo walem ka loptano lu lafa banko kan koto malu kay warandi kulke ke kuta yandi pour ye betia ye nyinya ye senia nga wodati la alfongo e banjul loptano jele do ko min beje ali polyclinique jele do ko min beje ali ajembe loptan kutol min be lokan be health post kutol min be lokan loptani jurmol min be bina kuta yandi kan fanna fulanjang wolen ka jorangol sang pour katara loptano to katung ringba president Barola mansakunda be sila ngatara jorang koto balle beje jorangol dolu bikatama dolu mansoto ngo fonga jorangol sang pour jorangol doktan dokulalu nosol nin doktarolu ni mo koto be lokon lab molu nin pharmacie nin physiotherapy be se jorangol soto la dokulke wo joran sama fanan jamale santa gonsa kunda ning nkafunyolu bantal bankol kan jora min kodo min santa joran la asiata wuri million kemeluluti wo jorangol mi lonko alal demaroto se molni tanka wo joran jamale sotota hani sambe joran do la fakan sabanjango nko fo boro li soto anyama lotano luto katum boro kumata bakele Gambia bika boro deda mbika bori deda bori na ta jang akasang bankol dole kan ba brim president janim president barobe sila ik mansakunda ka kodo min hayma puruka jate kende boro sang abika tambi dalaso million tan worola andu wo fam bebi ka soto nu ngami moy ba brim president baro sita ka nyinanteng mimbe defense la puruka boro sam banko be kan abitale fu min siata dalasi million keme fulati ya lo mula far balet pour boro kana manki bankoto and wo boro lu covid-19 nying safaro la kolea anin kulungol la tani namin be kolearing wole fangoy dol dile bari jamaya start kana jama be silo kannan nanin jangon ko fo doku lalu fanaye lafa doku lali min be jenge la karon lafa waya sabum be no su karambungol yele kam bansang ali karambung kuto jelembe min lokan mansa konko be la karambungo fanundi kan be doctor rolu specialize in dikang for the first time wo bika soto nunjal doctor rolu be karankan pour ka ke musolla doctor oti dinngol la doctor ke balla doctor minka operation oke mbol be ke kan jamba njullo tan batole sila wo kola mbe ku jamal ke kan ka mo kotongol karandi dentisol nyin doctor la karango fanandati ta jan pharmacie karango sambio be datle jang ku jamal le be keri inshallah jam fo montoro wati jama kawol be foye bari president nata mingie molka bata minke pour ka futa loptano to sando to modo luni silaba tema ay kilomita woro sile woro wula kilomita tan wo silolu hanitil kando kono e silolu tamandia sama ko neto fala sate jama moto bike laje anu molle bo sate ol fananto ye koleya jama fo inata fuko ni bital loptano to dolusi sere fali sere to kan dolu musu kono ma miya lonka be tingoto e sa sele ni motorcycle ka yalon bala fa balet ndata dula doto muso min ka tinguto ke abe ko do fola ako musu kono muso do kono yama iba sambaka loftano to pour janni be futala mana sila baka be falisare to kan sulol ye bendu ka kundun kuntu nyaato man tambino inata laba murun nale wo muso tata wulu sula kono do fana o fana manjam fo dula fanana biri wol fanan tata wo be falisare su sare to le kan sulol ye bendung ye fenka suwo fon silata borita musu kono ma be larin sare to kan sare to be sauna a borita wala nyama fa futata sila bakan bira futata sila bakan ne suwo fon kija faro nata tala anata dumanduma president ko nyini be mun na mole di mobe dawoda Gambia na mole mo andung mansakunda fay ku keye wala saba ko nyin community ambulance lu nata nyin community ambulance wolube tarla satewol le kono miya lonko nabe sate kilinto satewol mimbe odandangoli bele be dennala nimmo mi musu kono mabe tingoto ni musikono mabe tingoto wara mo sasa to be je minna sasa jawyata ibe ambulance wala number call la 116 mobile network connector be bulu andi te fenjola yo call ayne sika kabonang amari la subundato kata fo loftanoto wonne man so to Gambia
honorable minister mbe nyinin kala sign for community bijela ayeming identify already min yalan koy tolle be mona fanya ni ambulance solti nala yakele nyaade
a be distributale ya be jibele community lu jamfata silo la nyaming community lu e warata nyaming community lu jamfata loktano la nyaming na molia be checkle primary health care system o dobe non jele circuit system o ye wolle jibe ya jibe ambulance ol bita daming anin dulal mi mosiata anin motol fon la sia dula dolu moto bikata o ma fon la so nyin ambulance o keta ku baleti je minika foko politiko la sabu politiko manyin sabo bari mimbe caring you see nyin ko korosiba nin nyato tabina aka doman ye fo killing ye fula futa ye fula fula saba nani lulu nin do min nin politiko wato benta iko politiko la anin politiko wato le benta ambulance ol ferobe jele anin politiko wato benta andu yiriwa koten dole bina indin karte fay dole be benna so woma sabu ko karte fawle asabu because we atra go man sakunda ya fero sotole barala ala timma na da futa karte fay wa dole andu yiriwa famole ibe ku jamal de datila hani silol sila dole be datila pour ka doko bo holo dole be datila pour ka doko indin karte fawle bina benna muna karte fawle sabu ba kadu ninko mbokel no fula nyama beje do min beje bari niya famo jibe nga min famo fo molie munen politiko ti wala jamala nafa politiko fana moleti ni de la jama banko jama constituency molu iko la fa ambulance nim president wo ambulance nati ay jamala nafa to kadum banko molie kadre fa president wo mun kamma pour ay jamala nafa ke ay silolu doko ay karamol doko ay jioke dulalto ay alamtanol doko ay borol nati ay ambulance ol nati sila nabo kan ko politiko le ala do ko moltiko
so sa minna tukalom mutulu nying ila nyinto
yes
albe bulala jele comme community ko le be mutulu nyen wala ko nyindum government ye fuel ko tono jini wala every time ya nying motol la dapanso be mu government let ka bringi la fuel et la drive la jo et la maintenance abe mu masakundalet e ka fuel di mini betama kan already e ka fuel sotel so community te fenne fon jola nyinto fengo fen community ta jola nyinto e tolu pour ka call do hanimo call fon pour ka call it a credit fon san because nimpura o discuss le nin GSM company li a discuss le it a credit fon jola e ka fole toll free number it a fen jola nyinto
honorable minister be kumayal mol mimbe jube kan isa long ko do yiri ko jelle don tani ambulance sol nyin naken
nyinta de fo dalasi million keme aning million tan woro ni lulu mafan ni be falindiro daji be la biya be nyamin dollar la karola wala ambulance tan seyo ni sak
honorable do akake jakal kudo fodo honorable minister ila capacity as a minister of health ikata ka murumuru ngakele jata kendia bundal to mimbe Gambia banko nyi kanka force and information so de ka jebe tala nyaare fayka wakele ni capacity
ngaw ke sinya jama ngata banko beto banko la jata kendia bundal beto nga sinya jama keji do beje mfon kata madron ngadun singola moma kala mutambe dulal be jibe la mimbe keri nga oke bake banko la jada kende abundalu alhamdulillah ngamil lonje womu altento lati ibe min ke kan mbe yirwandi jamale ke kanje bari ning banko mol fana ye kuo minje abetamo kan dawoda kato ministre tatarano la dula beto andu mol fana salon fana ko banko kan mobe ni la do kulem banko kan mobe na la do kolem ye loptani je ladula bun beje mole maratala wodu beje mole maratala loptani mole maratala tundo fanan ministry ye mole sotoje mini maratala ni ye loptani bali je loptani balu de ku bunda be loptani ba nyin kono mole maratala an loptani bal fangoli mol soto min maratela banku doku o mobe yela do koke ministre ala do koke bari nyim molu fanan be yela do koke nim momo tata loptano to aje ko nyim molu mantare la do kokan ndol sa kalamuta katunde ko be kalamuta no la nima min fonye nje taje yo nyawonya bari kudolu ning mo tata je lebol jelano sasa to tata je bar ni ku taraje mi a lonko a me nyafa ndol ministry na bundal be yelerin ne suto tili furun sa kalamuta
abaraka okay mbitara koreji